Talk about salt for a minute. What kind of salt makes my blood pressure go up?
When we talk about salt, what we're talking about is sodium, okay? Or sodium chloride. But there is sodium and different kinds of sodium in many, many different kinds of foods and things that we consume. But it's the sodium that significantly contributes to high blood pressure.
And so when I look at the food label and it says sodium and there's a number next to it, if I were to go through the day and try to figure out what we need to keep that number less than, what would I be looking for?
The number that I would tell people would be about 2,000 milligrams or less would be ideal. Now, the fascinating thing is, how much sodium do we actually need per day, metabolically, physiologically? 220 milligrams a day.
So for my body to function normally, I need 200 milligrams, and you're giving me all the way up to 2,000 every day?
Well, I'm going to give you permission to, or I'm going to tell you, I want you to keep it less than 2,000, which is still about tenfold more than we need.
Wow.
So how much do we actually get, the average American get in our diet?
Yeah, exactly. So what is the average amount?
6,000 milligrams a day.
Goodness gracious. Well,
which is 30-fold greater than what we need. And then people say, yeah, but I don't add salt. The salt that is added to our food, that we add, consciously add, is about 11% of that total 6,000 per day.
So 90% of the salt we get, we don't even add ourselves?
Completely unaware of it. So it's already in the food we eat.
What food should we try to avoid? I mean, most of the foods that I eat don't taste salty.
We are so used to such a very, very high salt diet that we're completely unaware of it. Anything that you don't make yourself, processed foods, foods out of a can, anytime we go to a restaurant, you're pretty much guaranteed to be consuming a very high salt diet.
Okay, so that's number one. Number two is exercise. How does exercise help my blood pressure come down? I actually understand, I know as a family doctor, but I'm being the patient right now, I understand that the blood pressure goes up when I exercise. How can that be good?
Well, when we exercise, blood pressure should go up because our muscles need more blood flow, more oxygen, and that's appropriate. It should go up within boundaries. But if you ever exercise and then measure blood pressure after exercise, you'll see it's usually lower after we exercise than it was before. Because what happens is that causes those blood vessels to relax, and that's putting them through their paces, and that's a good thing. If we continue to exercise, our blood vessels continue to become used to relaxing, and that helps to lower blood pressure. When we don't exercise, those vessels always are maintaining a high tone, which contributes to high blood pressure.
So it's almost like lifting weights. The wall of a blood vessel has a muscle in it. That's what allows it to get smaller and bigger, right? Mm-hmm. So and it's almost like exercising is making that stronger by helping it exercise more and more. Mm-hmm. Okay, what was the third thing you said? Salt, exercise, and?
Losing weight.
Weight.
Weight plays a huge role. I see so many people who, they say, well, gosh, I didn't have high blood pressure a year ago, 2 years ago. And I said, well, has your life changed? Have you been exercising more or less? Have you gained weight? And they'll say, well, you know, I put on 20 pounds.
So I always used to hear that for every pound of fat you have, your heart has to push the blood another mile. Mm-hmm. And so if a person, the average American is 25 or 30 pounds overweight, if we took 30 pounds, every heartbeat, that's 30 miles. And how many heartbeats a minute for the average person?
It's a range between 60 to 100, or roughly for the typical American, about 100,000 beats per day, 100,000 times.
So 100,000 beats, and then if you take that at times 30 miles more, that's 3 million more miles the heart has to push the blood if you gain that weight.
It's a lot of work.
It's a lot of work on your heart, and it also, I guess, is a lot of work on your blood vessels. Huh?
No question.
Wow. So salt, weight, and exercise. Okay, so let's say I'm back to the patient again, and I'm saying, you know, Dr. Osborne, I have been watching my salt, I have been exercising, I have lost 4 or 5 pounds since I saw you last, but my blood pressure is still 142/92. Now, if 140/90 is okay, and this is 142/92, it seems awful close. Do I really need to take medications? I hate medicines.
Well, again, that's why I get out the blood pressure map. And what I do on that blood pressure map is there's 4 columns. There's A, B, C, and D. A is 115/75, and then they go up to 175/105. And what I do is I ask patients, because frankly, the burden of high blood pressure is not on me. The burden is on that patient, and I'm educating so that they understand what this means. So what happens is I label those columns and I say, which column do you want to live under? The column where you're at minimal risk, the column where you're 2-fold greater risk of fatal strokes or heart attacks, 4-fold greater risk of fatal strokes or heart attacks, or 8-fold greater.
I got it. So I'm ready to take my medicine now. Thank you very much. All right, so let's just finish up here by having you share with me a story of a patient that and how blood pressure affected her life.
Let me give you 2 examples. In fact, I saw a woman yesterday who had high blood pressure and was doing okay. She was on some medications. She was doing fine. And as it turns out, her blood pressure started to go up. She wasn't aware of this. And what happened is she actually bled into her head. She burst a blood vessel into her head. Now, typically when that occurs, the vast majority of the time it's fatal. Okay, you're usually dead before you hit the ground. That's how bad it is. And if it does not kill you, which is about 80 to 90% of the time, usually the remaining number of people are horribly disabled.
So 10 or 20%
in nursing homes, can't speak, can't talk, can't move their body. Well, she was extremely fortunate. Now, her blood pressure, when this occurred, was 260 over 140.
Goodness gracious.
Okay?
Very high.
And she literally burst a blood vessel in her head. Now, the beautiful thing is, I saw her yesterday. She's walking, she's talking, you'd never know it. She completely recovered. Her blood pressure is now 110 over 60.
Wow. And she has to take 3 or 4 medicines to do that?
Yeah, she's on some medications, but it beats the alternative.
Right.
And there's a wonderful example of someone that just about paid the price of hypertension, of high blood pressure, and yet we're able to take care of her, correct it, and she'll have a very normal, long, healthy life.
It's funny to me because you think that she would feel bad. Does high blood pressure not
the most typical symptom of high blood pressure is nothing at all.
Okay, so you can't tell if you've got high blood pressure or not until you actually take your blood pressure.
Absolutely.
Okay. You had a second patient you're going to share with us.
The second patient is unfortunately more tragic. 52-year-old gentleman, had high blood pressure, was on several medications because that's what it took in order to control it, and decided one day he just didn't want to take medications anymore. And so he stopped all his medications. Well, I was on call that weekend, and I get a call from the emergency room saying this gentleman had shown up, and he died. His blood pressure spiked up, and he bled into his head, and that was it. All but for control of his blood pressure.
So
completely preventable.
So the last thing I just want to touch on before we shut down today is you've talked about stroking out in 2 patients now. But is that the most common consequence of high blood pressure that we see in patients as they age if they have high blood pressure that wasn't controlled well?
Stroke and high blood pressure are intimately related. Whenever I see someone who's had a stroke, the first question I ask about is issues related to high blood pressure. The other thing, though, is kidney failure. If you ever go to a dialysis clinic, people on dialysis, you'll see all those patients have high blood pressure. And that's one of the reasons that they ended up requiring dialysis, because that high blood pressure attacks the kidney, destroys the kidneys, and then you're left with kidneys that don't work and you have to be on dialysis, which is very tough.
The pumping of the heart, the beating on the inside of that kidney, which is I guess a relatively tender organ, eventually leads it to scar down and die or quit working well?
And then, of course, the other thing is blindness. I've seen a lot of people who've had significant vision loss because of high blood pressure, uncontrolled high blood pressure. And then, of course, the heart, causing heart failure. Again, the heart is a pump. The work it does is blood pressure work. The higher that blood pressure, the harder that pump has to work. And the heart will work, but over a period of time, beating 100,000 times a day, when the blood pressure is high, it finally gets to the point where it goes, I'm tired, I'm beat, I just can't do it anymore. And then it begins to enlarge and dilate, and people go into heart failure.
So you're telling me that all these bad things that we've talked about today, we could have prevented just by keeping the number on the blood pressure cuff to what?
Ideally, normal blood pressure, remember, is less than 120 over 80. And that's where I tell my patients I'd like to see them, frankly.
And we have the technology to do that now.
It's simple, it's easy, we can measure it, we can detect it, we can treat it. There's no reason why we should have the excess rates of strokes, heart attacks, heart failure, dialysis that we see if we only took care of and treated blood pressure as well as we can.
Thank you so much, Dr. Osborne, for sharing that with us today.
My pleasure. Thank you, Scott.
And thank you all for being here on CVTV.